Thank you so much, Effort, for your kind words. It is really a big responsibility to integrate all of these fantastic contributions that clearly demonstrate the evidence-based knowledge amassed across the years by clinicians and researchers across different areas of psychology. And I will give it a go. When listening to all the contributions, key themes from the talks can be identified on determinants, actors, interventions, and outcomes, with inequities emerging as transversal to all the themes. Greenspoon's presentation made it clear that there are several mental health impacts associated with climate change, and that we have psychologists trained to deal with this. Abraham linked psychology with the built environment and evidence that it can shape our health and our actions. Barnes and Greenspoon demonstrated that it's crucial to understand and respect local realities, voices, and perspectives. Both presenters highlighted that inequities of climate impacts, those contributing the least and who have fewest resources, are experiencing the greatest harms. Greenspoon and Hornsey identified key psychological barriers to engage in change and introduced some of us to the concepts of hyperobject and attitude roots. Both Hornsey and de Smet demonstrated the importance of framing messages to overcome climate denialism and to increase mitigation behaviors, tailoring messages to ideologies and values. De Smet introduced us to concepts of co-beneficial and co-occurring behaviors and shared evidence that seems to demonstrate shared determinants. In my reflection, I will build on this, and I will particularly highlight the links between health behaviors and climate change and why it is important to understand these links. I will also present resources that I believe could be useful in order to transfer psychological knowledge towards better and fairer measures to combat climate change. Well, on the links between health behaviors and climate change, I first introduced to you a paper that is currently in pre-publication at Open Science Framework, or OSF. Here we try to understand how behavioral science can contribute to both mitigation and adaptation to climate change. And we started doing this by identifying bidirectional associations between climate change impacts and health-related behaviors. To do this, we synthesized the existing literature about, first, the inputs of rising temperatures, extreme weather events, air pollution, and rising sea level on individual behaviors. For instance, eating behaviors, physical activity, sleep, substance use, and preventive care. And second, we tried to synthesize existing literature on the concurrent positive and negative roles that health-related behaviors can play in mitigation and adaptation to climate change. This figure here synthesizes the associations found in this work. Here we can visualize feedback loops between climate change and health-related behaviors, highlighting that, first, climate change is shaping health behaviors, and that in return, health behaviors might have different impacts on climate change outcomes. Based on this literature review, we propose a first conceptual model of climate change and health-related behavior feedback loops. Key actions are proposed with particular consideration for health equity implications of future behavioral interventions. Whatever interventions we propose, they should not increase inequities. Actions to bridge the fields of behavioral science and climate sciences are also proposed. In this paper, we also contend that climate change is amongst the most urgent issues facing all scientists, and that psychologists also should face this as a priority. Another study that we are currently conducting is trying to gather evidence from expert psychologists to understand what can be generalized from decades of research on health behaviors to other mitigation behaviors that have health co-benefits, such as reducing red meat consumption and increasing active transport. In effect, there is a lot of research already on health behaviors, research on the determinants of healthy eating behaviors, for instance, and interventions already tested to increase healthy eating behaviors. There is also a lot of research already conducted on determinants of higher levels of physical activity, as well as on interventions to increase physical activity levels. The goal of this research that we're currently conducting is to learn from this past research and potentially generalize it to behaviors that can have to mitigation behaviors that can have co-benefits. To do this, we are using a repertory grid technique with interviews with expert psychologists. We are currently preparing a paper on this and will present this year at the European Health Psychology Conference in August on results. The reason we are doing this is because the current challenge is too great and we need to use as much evidence as possible that is already available. Indeed, the consequences of climate change can already be observed. Millions and billions of children are exposed to a variety of climate and environmental hazards. And this is very much linked with inequities, as you can see in this report published by UNICEF last year in August. The highest risk places on Earth contribute the least to the causes of climate change. The 33 extremely high-risk countries emit less than 10% of global greenhouse gas emissions. The 10 most extremely high-risk countries emit only 0.5% of global emissions. So again, the issue of inequities emerges. With the aim of sorting these issues, human societies all over the planet have come together. Scientists have been providing evidence for decades, and politicians from all over the world have been meeting and making agreements and signing agreements, and then making reports on where each country is on their pledges. But when we read these pledges, we notice that they are aspirational and sometimes not concrete enough. And as psychologists, we know that concrete plans are needed in order to implement overall intentions into practice. We also understand that in order to develop any measure with chances for implementation, we will need to engage users and stakeholders and account for contextual constraints. In order to implement any plan and to have this plan be accepted and feasible to implement, as well as sustainable across time, it is crucial to engage all local stakeholders and communities and to fully understand contextual constraints. This is what intervention development frameworks call for. Whatever aspirational pledges and measures governments, communities, neighborhoods, and individuals want to put into practice, it is important that we take into account psychological knowledge in order to assure that these measures have more chances of being successful. There is no time for complacency, and we need all hands on deck. And this is even more important when researchers quantifying the pledges made before COP26 suggested that there is a less than 50% chance of keeping warming below 2 degrees Celsius. In this paper, published last week, the authors demonstrate that warming can be kept just below 2 degrees Celsius if all conditional and unconditional pledges are implemented in full and on time. Limiting warming not only to just below, but to well below 2 degrees Celsius or 1.5 degrees Celsius urgently requires policies and actions to bring about steep emission reductions this decade, aligned with mid-century global net zero carbon emissions. So what resources psychology has to bring? Psychologists for decades have been amassing evidence on determinants of behavior, understanding what motivates people to change, and using this knowledge to develop interventions. There is a plethora of intervention development frameworks available. There's many characteristics that these intervention development frameworks share. I would say 3 are crucial. One of them is that the need to be evidence-based, so that interventions target proven scientific mechanisms of action. The second key characteristic, in my view, is engaging with users and stakeholders to assure interventions are acceptable and feasible. And the third is to make sure that whatever is proposed takes into account contextual constraints. If these 3 things are met, we are so much more sure that whatever we propose is acceptable, feasible, and will be sustainable across time. These 2 schematic representations that you see here come from 2 different papers. The first one, published in 2021, last year, by the BMJ, presents the MRC framework for the development and evaluation of complex interventions. The second paper is a paper I published with colleagues to try to summarize in clusters the different steps that the majority of the intervention and development frameworks suggest. As you can see, core to all these are the importance of considering the context and also the importance of having at its center the user and stakeholder involvement. There's another interesting resource, and this is the behavior change wheel. This paper was published in 2011, and they started writing this paper by doing a systematic search of electronic databases and consulting behavior change experts to identify frameworks of behavior change interventions. They identified 19 at the time, and they covered 9 intervention functions and 7 policy categories that could enable those interventions. At the center of this behavior change wheel is a behavioral system involving 3 essential conditions: capability, as you can see here, opportunity, and motivation. This forms the hub of a behavior change wheel, around which are positioned 9 intervention functions that go from education, persuasion, coercion, and so on, and 7 policy categories that could enable those interventions to occur. The behavior change wheel allows researchers, practitioners, and policymakers to understand that in order to change behavior, multiple types of intervention can be used as long as we understand what are the mechanisms of action that we're trying to target. Armed with this knowledge, my colleague Laura Koenig and myself went on to analyze and critically appraise the EU Farm to Fork strategy, published in 2020. This strategy is at the heart of the European Green Deal, aiming to make food systems fairer, healthier, and environmentally friendlier. Food systems cannot be resilient to crisis if they are not sustainable. We need to redesign our food systems, which today account for nearly 1/3 of global greenhouse gas emissions, consume large amounts of natural resources, result in biodiversity loss and negative health impacts due to both under and overnutrition, and do not allow fair economic returns and livelihoods for all actors, in particularly for primary producers. So we analyzed the strategy and set to understand what could psychology contribute to this document in order to make it more likely to be successfully implemented. From our analysis, we concluded that the strategy includes several actions targeting consumer behavior, including increasing the availability of sustainable and healthy products and mandatory nutritional labeling. The actions address relevant psychological mechanisms. However, the outlined actions are vague and based only on a small number of behavioral determinants that may limit effectiveness. The implementation might furthermore benefit from concepts of implementation science to increase acceptability and feasibility to reach its ambitious goals. Besides, it is important to acknowledge that upstream and downstream interventions are not mutually exclusive, and that countries will implement system-wide policies only if they believe that their population will accept these. Remember here the case of the prohibition to smoke in enclosed spaces, which took decades to implement. Indeed, there are several factors at different levels that influence the initiation and maintenance of behavior of individuals and populations across the lifespan. Well, as the President of the UN General Assembly, His Excellency Mr. Abdullah Saeed has stated at the start of this event today, finally, after 15 years of negotiation, access to a healthy environment is declared a human right. All of us can use our knowledge, our influence, and our work to make sure that this happens. To do this, we need to share our knowledge with all, including with policymakers. Next week, there is a PCUN webinar that will be training psychologists on how to write policy briefs. Effective communication between academics and policymakers plays an important role in informing political decision-making and creating impact for researchers, for psychologists, for all of us. I believe the future is bright when we work together for a better future for our next generation. And I believe that I made it clear that the next generation needs to be included as stakeholder in the work towards a healthier planet. Together, I believe we can do it. This is a list of references, all the things that I referred to and used in my communication can be found here. And thank you so much for your attention.